According to the Associated Press, the largest vaccination campaign in U.S. history is underway as a critical care nurse in New York City named Sandra Lindsay was among the first in the United States to receive a COVID vaccine at the Long Island Jewish Medical Center where she works. This happened this morning. She said, quote, "We all need to do our parts to put an end to the pandemic," end quote. Sandra Lindsay was given a vaccine engineered by Pfizer, which was approved by the CDC on Saturday and received approval by the FDA earlier than that. So I want to read to you this passage here from the Huffington Post in an article titled "First COVID-19 Vaccinations Begin in the U.S." About halfway down the article, it says, quote, "Robert Redfield, the director of the Centers for Disease Control and Prevention, on Saturday approved the Pfizer vaccine for Americans aged 16 and older as the company began rolling out vaccines for its distribution facility in Michigan. Redfield's okay came a day after the Food and Drug Administration officially approved the vaccine for emergency use. An initial round of about 3 million shots will be shipped out, with the first doses earmarked for healthcare workers and nursing home residents," the Associated Press reported. Trucks were set to deliver the vaccine to 145 distribution centers across the United States by Monday, with an additional 425 sites on Tuesday and 66 remaining sites on Wednesday. So this is all hands on deck. It's come definitely. It's definitely, it feels like it's come late, but that's only because the United States has handled, under the Trump administration, has handled this pandemic so terribly, right? If we had another administration in power instead of the Trump administration, you would not have seen the loss of life. So it feels like this is coming late, but it's really kind of in line with where a lot of other countries are at the moment as well. Now, I wish I could tell you that that's all there is to report, and it is most of what there is to report. But I do want to show you this one article here from Fortune. Now, I'm not a big fan of the source, but I wanted to find something that was relatively recent, and this was the most recent article that I could come across. It's titled "Side Effects, Dosage, Price, and More: Everything You Need to Know About Pfizer's COVID-19 Vaccine." About halfway down the article, under the subtitle, "How much will the vaccine cost?" it says, quote, "The U.S. government has paid Pfizer and BioNTech $39 per dose for the first 100 million doses, and Americans are expected to pay very little out of pocket to be vaccinated. Medicaid, Medicare, and most forms of private insurance will be required by government mandate to cover vaccine costs for patients. Even uninsured patients should be able to get vaccinated at low or no cost. A special fund has been set up to reimburse providers for those shots." Now, I bring this up to explain to you my only real problem with this. And it's not so much a problem. It's the structural issue that I have with this whole situation, which is an issue with the fact that there's no Medicare for all. So this vaccine should be just free. It shouldn't even be a question of whether or not it's free. That is the morally right thing to do. We shouldn't be charging anybody. I mean, they say at a low cost, but what is a low cost? And who decides from an article written in Fortune.com what's a low cost and what's not a low cost? Are we talking $100? Are we talking $150? Are we talking $50? I mean, to people living paycheck to paycheck, even a $50 or $100 vaccine cost is a lot of money, right? So that's the only that's the only thing that I have an issue with. But definitely check out my videos that'll be coming up later this week. My name is Brian Lewis. Like, subscribe. Click the bell to be notified when future videos are posted, and thank you for watching.